Hello, everyone. Welcome back. Thanks for sticking around to this panel. We know that we're all quite zoomed out. My name is Photini Vrikki. I'm a lecturer in digital culture and media here at King's. This is the final panel for today, before the keynote. As the title of this panel suggests, we will discuss aspects of surveillance statism, and our speakers will explore the fusion of the state and surveillance and how that has become a thing during the pandemic, starting from the impact of data exploitation, both from the state and actors beyond the state, but also to discuss authoritarian surveillance that has been deployed during this pandemic. We're going to discuss things in the role of fear and trust, as well as the algorithmic state vision around the globe. So each talk will take about 15 minutes. I will introduce each speaker before their talk, and after we're done with the talks, we will have around half an hour for Q&As. I'll now give the floor to our first speaker, Blum-Dumontet. Eva is a senior researcher at Privacy International. Her work focuses on the impact of data exploitation and automation on individuals in vulnerable situations, and in particular, their ability to access healthcare and welfare services. Her previous research projects focus on smart cities and the intersection of gender and privacy. Prior to joining Privacy International, Eva was a journalist. Today, she will share her views on tech solutionism as the answer to the pandemic, and how we can understand the impact this has on our human rights. So I'll give the floor to you, Eva. I hope you can share your slides. Let me just unmute you. I think you should do that. I don't know why you're muted.
Yes, I can unmute myself. Let's see if I can share my screen. Let's see if I'm going to get lucky this time. Let's see. No, it doesn't look like it's going to work. Okay, so Photini, I'll let you share show the slides for me, and I'll just tell you next throughout, if that's okay.
Yeah, that works.
Brilliant. Thank you so much. Sorry, I'm just going to do it at the same time. Yeah. Okay, next. Perfect. Okay, there's the word pandemic missing, but that will do. I don't know what happened. So basically, hi, my name is Eva Blum-Dumontet. As Photini said, I work for Privacy International. So before I start, I just wanted to give a little bit of background and context about what Privacy International is. We are a charity that's based in London, and well, as the name doesn't really suggest, actually, we don't just work on the right to privacy. We really try and have a broad approach on technology, and we advocate for research and litigation and advocacy for a world where technology is really there to empower people instead of exploiting them for their data and for profit. And so as part of the work we do, historically, we've been looking at, a broad range of issues, and among them like ID systems or healthcare and health data or state surveillance. And what's been really interesting actually was the current pandemic was to see how the different subjects we had been working on were sort of all colliding into one big issue. Next slide, please. So when the pandemic started, we decided to map out the government and companies' initiatives that we came across. And the reason we did this, and basically, I don't know how many of you were born at the time, but we were very much marked still by what had happened in the back of 9/11, where we had to really the world changing and the legal framework changing in the name of the terrorist threat. And yet, even as the very terrorist organizations that, had threatened the United States back then had disappeared, the new measures that had been put in place, the surveillance measure that had been put in place, the changes to the legal framework, that did not change, that did not end. In a sense, it became our lives. It became the new normal, even though the way we traveled had been reshaped by these events. And also, I mean, a bit closer to us and closer in time, back in 2015, when France saw a wave of terrorist attack at Charlie Hebdo and at the Bataclan. After that, we saw the state of emergency being put in place. And what was really also interesting for us was to see that actually there was never really an end to the state of emergency, because, once the state of emergency ended, it was de facto voted into law. So what was the features of the state of emergency became common law, became the regular law. So this is why we felt like we had to start mapping out what was happening so that we could keep a check and keep a record of what were the initiatives and what was happening to this. Next slide. So at first we noticed some project that came from East Asia because that's where the pandemic started. Next. So yeah, China, next. Yeah, so we had, well, it's, they were initially from like China, South Korea, Thailand, but almost immediately at the same time, we noticed that tech companies were jumping in as well. Next. So we had like companies like NSO, which was sort of a traditional surveillance company from Israel that was, well, they had offered usually spyware in the past. Now they were turning towards geolocation tools, but also like social media, like Facebook. Next. Google, more of Facebook, and next, Twitter as well. Next, yeah, there was also Vodafone companies, so like phone providers that were also jumping in. And this is not to say that this is necessarily something, something bad or something shocking. I mean, we also have to understand that in the context of what we were going through, there was a desire to take part and join in the so-called war effort, almost. And so, but the concern here is rather that no one was quite prepared for what we were experiencing. Governments, obviously, as we have seen, were not entirely prepared, but all those companies that suddenly jumped in and offered solution, they had no experience themselves with like what is the proper way of responding to a pandemic. And the next chapter was the question of apps, and many countries started developing their apps with various degrees of success and implication from civil society. So, for example, in Qatar, there was the way the app worked is that the app was de facto creating a QR code that the police could scan that would reveal personal information about you, and obviously your status if you were COVID positive or negative. And there was a major security flaw on this app that was exposing the personal data of their users. In Germany, there was much more conversation with civil society. So early on, they managed to get to a point where the app, that people trusted the app. In the UK, it started with an initial version of the app that was very problematic. And eventually civil society was consulted, and so there was quite a lot of dialogue until we got to the point of the app that we have now, the NHS app, which is a fairly safe one to be using from a privacy perspective. Now, next slide. Some of the concern around the apps in general, but particularly that we've noticed was like the early version of like the British app is that, first of all, some of those did not work on older phones. So you were excluding a whole portion of society that cannot afford the latest iPhone or the latest version of an Android phone. And some of the apps were actually very much draining the phone battery, which means especially when you're an essential worker, like if you're a driver, for example, you need to have your phone available at all time. You can't really afford to be running an app that's systematically draining your battery. Some of them, as I said, I mentioned Qatar had security vulnerabilities, but also there was the larger question of like, what do we do about people who don't have smartphones or who don't want to download the app? And when we saw some countries like Russia, for example, making it mandatory, well, it raised obvious questions about what about accessing basic rights? What about being able to get into shops when you don't have a device like that or you don't have the right device? What alternatives do we offer to people? Next. And a lot of this came represent a concept that we've come across quite a lot. And as I said, I used to work on smart cities, and that's definitely something we've seen quite a lot of in like questions of urbanization, is the concept of tech solutionism. And it's this belief that when you have an extremely complex problem, one that you cannot solve yourself, and a lot of the problem associated to actually running a cities, all this type of cities, like how do we make sure that we have an efficient transport system that delivers good quality transport for a city? How do we make sure that the cities are accessible to all and differently able people as well can access what the city has to offer? How do we make the cities greener? There's this hope that you can somehow have an app or a technology that's going to give you the answer to all of this. And so obviously when we're faced with an unprecedented pandemic, there was the hope that somehow a technology could magically fix it and fix that for us. Next. So many of those solutions that we've seen impacted our privacy in an unprecedented way. And yeah, there was also the question of like what safeguards are there to guarantee that the measures would end. And as I said at the start, well, as I should have said really at the start, is that this is not to say that like we are, against lockdown or against asking people to be wearing masks or even against contact tracing. A lot of this are very legitimate measures that are absolutely required to put an end to a pandemic, to try at least limit the number of deaths in a pandemic. Yet what we need to have for all those measures that are put in place is the assurance that there will be an end to it, that there will be a deadline. Now, obviously, when you have, for example, a situation like a lockdown or shops closing, we see it really. It really impacts our daily lives in a way that we know when it's going to end, or we're going to make demands if it doesn't end. We need to have those deadlines. That's really essential for people in how they function. This is a constant demand from society. Now, there are other ways, obviously, when data come into account, when surveillance come into account, where it becomes less sort of obvious because it doesn't interfere with our lives as much. So we stop necessarily paying attention to the fact that the rules may have changed, that what the government is allowed to intercept or to demand in terms of your data may have changed. Like for all of us who have downloaded the NHS app, we haven't necessarily asked ourselves, okay, but when do I get to remove this app from my phone? So that was really one of the important question for us, is like, and one of the things that motivated us initially in doing this mapping is ensuring that those methods would end. Next. And also, the problem with solutionism is, as I said, there is this belief that technology is going to solve it all. But actually, what are the evidence that we have that this is actually working, that this is actually the answer to the problem you have? And, this is not to say that contact tracing, for example, through the NHS app didn't work in the UK, but I think it's fair to say that already, and again, I say this with a lot of with a lot of caution, because I'm not an epidemiologist, but I think it's fair to say that, like, looking at the situation worldwide, we sort of have indications of like what has helped and what has been sort of a game changer in fighting the pandemic. And we can see that having access to PPE, to protective equipment for medical staff, we can see that asking people to wear masks, that lockdown help, that for people to be able to quarantine and to have the support they need to be quarantined help. And obviously the vaccine, where ultimately the massive sort of like game changer in this pandemic. But all the solutions are extremely complex, or extremely costly as well. And so, yes, it's so much more friendly and nice to just tell people you're going to get to download an app, and this is all going to be back in order. And I am afraid, like back in March and May of last year, this is unfortunately was very much the discourse. The discourse was like, once we can have an app and sort out, contact tracing, everything will be back in order, which didn't quite work out this way. And so this is why, for the last part of the presentation, I just want to quickly go over a case study. Next. So this feels very weird for me to be talking about Israel in the current context of everything that's happening, and it's a bit weird for me to be dealing with this. And obviously, when I prepared the presentation, like the situation was very different. But so Israel had an interesting, to say the least, way of responding to the coronavirus crisis, which was unlike any other countries in the world. I don't think there's been any other instance of a country that used its intelligence services for contact tracing. Now, while it's very unique, I think it's actually quite interesting to look at what happened in Israel to challenge this perception that the use of technology is going to be the answer to all these issues. And so, as I said, in Israel, what essentially happened is that the government authorized the use of the Shin Bet, so the intelligence services, to conduct contact tracing on a mass scale. So the way it used to work is that when if you were tested positive for COVID, your personal data was being shared with the intelligence services, and because of the systems that they have in place, the intelligence services would track back everyone you had been in touch over the previous 10 days or so to see and let your contacts know that they should go into self-isolation. Now, there was a lot of pushback from civil society on this, and so civil society organizations in Israel took the government to court, went to the Supreme Court over this. So there was pushback including from the Arab parties, but also from the National Union of Journalists, and because for them, there was a key, a really important issue, which is how do you protect your sources as a journalist when you're constantly being tracked. So next. So there was a long legal battle. Eventually, the civil society won, and this was the use of the intelligence services no longer in place at the moment. Next. Next. So did it work? And this is what I want to be ending on, is that next. Essentially what happened in retrospect is that there's been various reports from the Commissioner's Control and from doctor unions that actually were showing that the contact tracing that was done by the intelligence services was actually not as useful and didn't work as well as traditional form of contact tracing, where people were being asked to share who they had been in touch with. And the consequences of like bad contact tracing is that you end up asking people to self-isolate when they shouldn't have to self-isolate. So people who might be carer, people who might be working in the health sectors, people who might be, should be caring for others, were forced to self-isolate when it wasn't necessary, whereas actually asking people who they had been in touch with led to better results, because people know who they've effectively really been in touch with, who they have a better chance of actually affecting. So the next slide and the last slide is really a call to pay very close attention to a lot of those quick fixes. And at the moment, there's a lot of talk around immunity passports in the UK, and especially in a context in the UK where there's always been a tradition of not having ID cards, and that has been very much part of the human rights tradition in the UK to not carry an ID. We need to remember that when we have drastic measures like asking people to carry immunity passport, you will radically change the structure of your rights, and this is why this is something we need to keep an eye on, even if it sounds like a good quick fix. That's it.
Thank you, Eva. Thank you so much. That was really, really nice. And I think it's going to provide a good background into going into the rest of the panel today. I'm just going to go directly into the next speaker. Oops, where are my notes? Azadeh Akbari is an academic at the Political Geography Working Group at the University of Münster, Germany. Her research interests include surveillance in authoritarian contexts, immigration policies and their use, biometric data banks, and spatial justice. Azadeh was a journalist, a feminist activist, and a communication specialist employed by different UN agencies and international organizations in Iran and internationally. She's also the founder of Surveillance in the Global South Research Network. So Azadeh will be talking about authoritarian surveillance today, which is, I think, a good follow-up from what Eva was talking about. So with no further ado, I'm just going to give you the floor. If you want to start sharing your slides as well, that would be great.
Thank you very much, and thank you very much for the kind introduction and invitation. I'm going to share my slides. And here, and here. I hope you all see what I have.
Yes.
Okay, perfect. So this presentation is based on a paper with the same title published in the Surveillance and Society Journal. So if you want to look up references in the presentation, you can just find them in the paper already published. It has started with a simple question. Throughout the pandemic, there was a lot of discussion about China's successful control of COVID-19 through intrusive surveillance technologies. And as a researcher focusing on surveillance in Iran, I expected a similar approach from the Iranian government, which routinely imitates Russian and Chinese strategies in internet governance and surveillance methods. At the beginning of the pandemic, Iran was recovering from a bloody suppression of protests against an abrupt fuel price increase. According to Amnesty International, security forces killed at least 304 men, women, and children during the unrests. And it was also especially important because for the first time, the newly developed national internet was used for 4 days in Iran. This meant access to the international internet was shut down, and this was a new milestone in testing getaways to the outside world during an uprising in Iran. Despite this unsettling history of control and surveillance, the Iranian government's response to COVID-19 was hardly any. The first lockdown was unsuccessfully enforced almost a year after the outbreak of the pandemic. Although the Iranian president had threatened the protesters with facial and license plate recognition during 2019 uprising, and despite police officials' claims that CCTV-based facial recognition technologies are matching faces with national IDs, none of these technologies were used for coronavirus contact tracing. And as the world seemed undecided in praising China's crisis management through what was formerly called network authoritarianism, countries such as Iran showed no interest in extending their notorious political surveillance practices into the public health arena. As a result, I asked myself if the umbrella term authoritarian surveillance used by many Western and non-Western scholars, including myself, can do justice to the practices witnessed during the COVID-19 pandemic in countries such as Iran. I asked, could any act of arbitrary or oppressive surveillance be categorized as authoritarian surveillance? And does authoritarian surveillance necessarily correspond to an authoritarian state form? So in the next slides, I will try to elaborate on these questions. And I'm going to shortly talk about authoritarianism in political theory. It's quite interesting to see if theories of totalitarianism were flourishing at the first 3 quarters of the 20th century. The transformation of these regimes to a less controlling form of authoritarian rule paved the way for a new set of political theories. One of the first theories on authoritarianism defines it as political systems with limited, not responsible political pluralism, without elaborate and guiding ideology, without intensive nor extensive political mobilization, except some points in their development, and in which a leader or occasionally a small group exercises power within formally ill-defined limits, but actually quite predictable ones. So this attempt by Linz was to describe the political intricacies of Franco's Spain, but other typologies of authoritarianism with a focus on South America soon followed. These accounts concentrated more on the level of modernization rather than mobilization or pluralism. They matched traditional populist and bureaucratic authoritarianism with low, medium, and high levels of modernization. So, for example, traditional authoritarianism was connected to low levels of modernization. This line of thought continued to elaborate more on the blurry lines between democratic and non-democratic systems. And the researchers published a massive 4-volume study of democracy in developing countries. Here, democracy was conceptualized as a continuum between pseudo-democracies to semi-democracy systems. In pseudo-democracies, multi-party electoral competition, for example, masked the reality of authoritarian domination. In semi-democratic systems, despite their limited yet competitive elections, electoral outcomes deviate significantly from popular preferences, and/or some political orientations and interests are unable to organize and express themselves. In between these two poles of continuum, there is a less personalized, coercive, and unstable version of pseudo-democracies, and they called it as hegemonic party regime. As the history unfolded, the process of democratization was discussed more cautiously, as many authoritarian regimes seemed to be quite stable and the transition to democracy was not on the horizon. Therefore, the concept of semi-democratic started to evolve into semi-authoritarian. This is an interesting twist in political thinking. It was argued that semi-authoritarian systems are not imperfect democracies struggling toward improvement and consolidation, but regimes determined to maintain the appearance of democracy without exposing themselves to the political risks that free competition entails. The flaws in democracy then were deliberate. They were not transitional. This hybrid conceptualization of authoritarian and democratic rule is still dominant in political science and reflects the reality of many political systems, even in countries formerly known as democracies. This short review might help us understand the complicated relationship between surveillance and democracy. Surveillance studies has mostly discussed how modern surveillance technologies can or will undermine democracy. In critical debates about the relationship between surveillance and democracy, it has been argued that democracy is much more than a system for making decisions. It is also an idea, a doctrine, a set of institutional arrangements, and a way to relate to others. So democracy is understood beyond its political borders. This understanding of democracy also puts emphasis on difference when it comes to universal concepts such as democracy or authoritarianism. For example, Murakami would argue that while surveillance is involved with processes of globalization, it is also not necessarily the same surveillance society that one sees in different places and at different scales. Surveillance is historically, spatially, and culturally located. So in a similar way, authoritarian surveillance is also situated, and this situatedness should be considered in any discussion on non-democratic, less than democratic, or arbitrary surveillance. Now we're going to look quickly at the history of using the phrase authoritarian surveillance. For me, it was interesting to see where it comes from. And the combination of authoritarian surveillance and modern digital technologies was initially used to address surveillance in post-authoritarian societies. In 2011 in Romania, a conference called The Ghosts of Surveillance underlined the significance of authoritarian surveillance operation and legacy to the understanding of current surveillance processes. The emphasis on the legacy of authoritarian surveillance is also an interesting reminder that many of these regimes maintained extensive controlling surveillance measures even without modern technologies through networks of civilian informants, secret police, and obligatory party loyalty. Apart from the historical burden of the countries transitioning from authoritarianism to democracy, or as argued earlier, to hybrid forms of authoritarianism, there has been prevailing research interest in how surveillance technologies enable authoritarian regimes to sustain and maintain power. So there is less of this rosy picture of assuming internet and social media as liberation technologies, and there is more of worrying that governments with network authoritarianism are learning quickly and pouring unprecedented resources into building their capacity to influence and shape digital communication networks. Many others soon voiced concerns that network platforms are not intrinsically democratic and can be tools of oppression. That being said, it seems that we have two very different things in hand. At one hand, we have digital surveillance's contribution to authoritarian stability, and at the other hand, we have a global increase in authoritarian practices of surveillance in democratic countries. And this could lead to conceptual disarray. For example, the Journal of Surveillance and Society published a special issue on the global turn to authoritarianism and after. And interestingly, 16 out of 29 submissions were from countries that have one form of established authoritarian rule. Even the editorial of the journal said, in the global south, it makes little sense to talk of a turn to authoritarianism. Rather, the situation is one in which authoritarianism is both constantly likely and often seems necessary or more attractive than the other alternatives. This already indicates that the difficulties to conceptualize what authoritarian surveillance could mean for researchers from different disciplinary, political, and national backgrounds. For some examples about this research, you can, for example, look at the way researchers in Turkey or in Iran and Russia have used assemblage theory, for example, to analyze authoritarian surveillance, or other researchers who are using practices other than state forms. So as you can see, there are many approaches to authoritarian surveillance. And going back to our Iran case, I hope to answer some of the questions we have encountered up until now. Iran suffered through some of the most crippling sanctions during Trump's presidency, with a negative GDP, surging prices of basic goods, the national currency losing value, and an unprecedented drop in oil exports. The economic turmoil caused general public discontent and incited widespread protests. As I said, revolutionary guards opened fire at demonstrators, and you can think this is shooting Sheikh regime legitimacy in foot. So the COVID-19 pandemic brought legitimacy as a determining factor to the surface, whereas China, South Korea, and Singapore could implement extensive mass surveillance due to public cooperation and high levels of regime legitimacy. The lack of regime support in Iran curbs their ability to enforce such measures. Legitimacy does not manifest only in accepting restrictive policies, but also trusting that the government rules with people's best interests in mind. It is hard to establish such a relationship when people are recently shot on the street. In addition to public trust and acceptance of arbitrary surveillance measures, such operations require a well-established information and communication technology infrastructure. Although Iran invests massively in political opposition surveillance through active censorship of the internet, interceptive methods, arrest and intimidation of users, and developing cyber police forces, it lacks the institutional power and the infrastructure to execute mass public surveillance, such as those in China and South Korea. The deficient infrastructure become evident in the failure of distance learning during the pandemic. This is something that I'm researching at the moment, and I'm comparing different 10 member states of economic cooperation organization in the region to see how they have developed these substitutional educational platforms during COVID-19. So, for example, in Iran, 21% of students have no means of acquiring a digital device to access the platform at all. 38% of students are not connected to the National Virtual School platform in Iran, and additional 20% have registered but are not active on the platform. So almost 70% have basically no access to the platform. And even with a digital device, other deficient infrastructures such as electricity or internet and mobile phone coverage cause further problems. As you can see in this photo, in many villages, students have to climb nearby mountains to receive internet coverage on their mobile phones. So finally, although periods of surveillance surge, as already pointed out in many presentations today, allow the rapid and overt introduction of new technologies with less public debate than usual, and despite the normalizing effect of surveillance solutionism through successful control of the COVID-19 pandemic in countries such as China, many other authoritarian regimes do not have the social, political, and economic capacity to implement mass surveillance at a time of crisis. As we have seen in Iran, the lack of trust and legitimacy and insufficient infrastructure, soft and hard, limits the potential for mass public surveillance and a global crisis that could have provided a context for more aggressive surveillance has not yielded the same response in countries known for their authoritarian surveillance practices. So I would like to conclude here that authoritarian surveillance is situated at the intersection of many other historical, political, colonial, global, cultural, economic, and social strands. And any research on authoritarian surveillance then should position itself in this intersection, considering the continuities, disjunctions, and frictions amongst these different aspects. Thank you very much for listening.
Thank you so much, Azadeh. It was really interesting. Okay, so I'm going to go ahead and introduce our third speaker, Kirsten Hillebrand. She's finishing a PhD at the University of Bremen and will start her postdoc position at the Bern University of Applied Sciences in June. In her research, she explores how civil society can actively participate in mobilizing and improving data by sharing or generating personal data sets. Today, she will talk about the role of fear and trust when disclosing personal data to promote public health in a pandemic crisis. So I'm going to give the floor to you directly, Kirsten. I'm going to mute myself now, and I hope you can just share your slides as well.
Thank you very much for the introduction. Can you see my slides?
Yes, great, thank you.
Okay, perfect. So yes, I'm Kirsten Hillebrand, and I would like to talk about the role of timing when those state measures of data collection are implemented, because as I find timing has a specific role when doing so. And of course, to start with Corona, early last year, the coronavirus hit us all very hard. And of course, in times of crisis, the state is expected to take action, yes, and that's what many states did, because they implemented extreme measures to stop the virus spread. And in a lot of democracies, governments restricted fundamental basic citizen rights. However, surprisingly, not much protest resulted, at least at the beginning of the crisis. That changed later on. So maybe citizens thought that, okay, in a crisis, security comes first. But what I was wondering is, at that time, is that when different rules seem to apply in a pandemic or in an extreme crisis, is that even the case for data and data privacy? And although international governments tackled the crisis very differently, one measure was quite popular, which was to use data and citizen data in order to control the virus spread. And solutions were quite diverse. We've heard a lot about them today. Now finally, there are some solutions that rather respect privacy of data. For example, in Germany, we have an approach that is based on Bluetooth rather than location data. But at the time that I was conducting the data and the time when those measures were implemented, that wasn't really the case, and the discussions were evolving around location data, health data, and so on. So what is important here is that very broadly, those measures can be divided into two categories, which is the voluntary disclosure and the disclosure of data mandatory by the state. So usually in our everyday lives, we are all not so hesitant to share our data, maybe, broadly said, even when facing privacy violations. And based on the privacy calculus, which is usually used in research when referring to those decisions facing privacy violations, we are often actually very inclined and happy to share our data because we get a certain utility back. And this utility can be quite diverse. Studies have shown it can be personalization, it can be the service itself, it can be financial rewards maybe, but we get a direct personal utility. And that's, after all, the reason why we are all still using Google maybe or Facebook, because we pay for those services with our data. However, if we consider the data sharing in a pandemic, then the privacy risk remains, but the personal utility becomes uncertain. Because, and that is an important point, data of one person alone wouldn't be sufficient. You need to have a sufficiently large number of people who would also disclose their data. Like when you run data-driven technology or do statistics, so you need a broad data set. And that is why the people in the pandemic in 2020 usually had a trade-off, if they could decide. Because if they chose the voluntary disclosure, then, okay, I assume everybody might want to live in a governmental system in which privacy rights are respected, which would be the case in the voluntary disclosure, but there would be an uncertain individual benefit regarding that people don't know if enough people would donate their data so the virus could be controlled. On the other hand, they might be willing to choose the obligatory disclosure because that would make them or set them on the safe side. Of course, they might take the violation of privacy rights by the state, as the state might not be entitled to collect that data, but data from all citizens living in that nation would be collected if they have a designated technology, but people would be on the safe side. And I was wondering, how would people decide in this trade-off? And that's the most important part, how would fear and uncertainty influence the trade-off? Because at that time, when I was conducting this paper, which was in March 2020, it was really a time of uncertainty because here in the graph you see the number of newly infections in Germany. So infections rose exponentially. We didn't really know much about the virus, and uncertainty and fear were really characteristics of that period. So I was wondering, how does fear influence this trade-off? Would people be willing to give away their privacy rights to the state in order to be safe? Or would they want to rely on the voluntary approach and be willing to disclose their data? So, long story short, I investigate how fear and trust influence the consent to disclose personal data to the state, here in order to promote public health in a pandemic crisis, and if citizens are more likely to consent to voluntary or to mandatory data disclosure. This is my research model. I will just quickly walk you through, as there won't be enough time to show you all my hypotheses. So as indicators for the payoff, I used fear for the public and fear for self and closest people. So I differentiated between fear for in-group and out-group, as that might have an impact. And fear in the sense that if the virus could be controlled by using a lot of data, then the harm of the virus can be stopped in a way. So it would be a kind of a payoff. Then second, I included trust, which is very important in or when considering decision-making or cooperation-making under uncertainty. And I considered two kinds of trust. First of all, the general interpersonal trust, which can reflect on, do I think or do I trust other people that they will comply with the corona rules? Do I trust other people that they will also use these voluntary data approaches? And the trust in the government, because the government in this case is the recipient of the data. And trustworthiness of the data recipient usually fosters the consent to share data. So I argue, based on literature, that most of these, or all of these with one exception, increase the consent to data disclosure, both voluntary and obliging data disclosure. And there's one exception, which is interpersonal trust. Because when you remember that trade-off, people are more likely to disclose their data if they expect others to do the same. So if people trust each other, then they might not use the state in order to enforce data donation or data collection, because the society itself might make it. So this is an important part. First, interpersonal trust decreases the consent to legally obliging data disclosure. And second important effect, fear for self and closest people would also decrease interpersonal trust. And that is because if you are very anxious or fear a lot for your health in this case, then you can't afford to be cheated on or to be defected on. So you rather tend to trust less. How did I look at this model? So I conducted an online survey at this particular period in March 18 to March 29th in 2020. And I reached a final sample of 889 participants, which I recruited from Facebook and Instagram. And that's not such a common measure, but I wanted to reach a broader part of society. This is in German, forgot to mention that. So German society with sponsored posts and stories. So I just run an ad basically. And I distinguish between two conditions. So one group of people only saw the questionnaire on the voluntary disclosure, the other one only on the obligatory disclosure, so they wouldn't compare but answer intuitively. My variable of interest is the consent to disclose data, and of course everyone is assigned randomly. So this is an extraction of my results. We see two models. The first model has the consent to voluntary disclosure as dependent variable, and the model 2, the obligatory disclosure. And here you see the variables I looked at. So first of all, the fear for the outgroup, which is fear for the public, indeed increases the consent to obligatory data disclosure, while it has no effect on the voluntary disclosure. Then the fear for the in-group, effect for both. Trust indeed decreases the consent to obligatory disclosure. So if I trust other people and society, then the role of state might not be that important to me when collecting data or disclosing data. And trust in government is not surprising. Okay, if I trust the state more, then I would provide my data more. Then another effect is age, and I didn't control for that, but I was assuming that it could be a similar effect like trust, because if I'm of older age, then I might be in the risk group of corona and thus can't afford to rely on voluntary approaches. So I might want to make sure that data is collected and the state does what it can to control the virus, to put it very simply. And I also controlled for the timing. So I coded in a 12-hour interval and looked at how the timing, like the further in time we were, the less people were willing to disclose data or to consent to obligatory data disclosure, like this, which is also an indicator that timing matters, basically. So all these results put back in our or in my research model. We were looking at the direct results, but as you remember, we also have this indirect hypothesis. I didn't show you the tables because I ran several models to do this, but we can take a look here. So indeed, fear for self and closest people increases, decreases, very important, the interpersonal trust. So the more I fear, the less I trust people. And the less I trust people, the more I consent to legally obliging data disclosure. So fear does not only have a direct effect, but also an indirect effect on the legally obliging data disclosure. And I think that is very striking because of course, I didn't cover all variables one could cover, but it's a very highlighting example that fear in extreme situations can change people's preferences. So one should be very careful when to implement such measures. So my key takeaways are that fear and trust indeed correlate with consent to data disclosure in 3 ways. First of all, consent to data disclosure depends on how anxious people are about themselves and their loved ones, so about the in-group. Consent to obligatory data disclosure is more fear-driven than consent to voluntary data disclosure. And fear for the in-group also indirectly promotes consent to obligatory data disclosure by fostering distrust in others. And again, as every study, this one has limitations, of course. For example, I only looked at the German society. It might be different in another time period. I could have included more variables, like always. But what I'm trying to say, which I found very striking, is that timing matters and that a lot of governments didn't educate the public before such a pandemic. And this isn't, a pandemic is one example of a crisis. There can be various more and there will be in future. So there might be ethical considerations when also this vast discussion on risks and potentials of data is set or is performed within a pandemic. I think that should be done before or after. And of course, now we didn't really have a choice because it didn't happen before and it might have had an impact. So we did it and that's okay. But those results, among others, show that for the future, the civic society should be educated better on what they can do and what their choices are, and also what the risks are they choose with disclosing data. Thank you very much.
Thank you so much, Kirsten. That was really interesting. I think it links back to what Azadeh was saying about the trust that citizens have on the state. So how do we change, how that depends basically on each democratic or authoritarian state. I guess we can talk more about that when we move into the Q&A. So we're gonna move into the fourth and final speaker for today, Chang Jin Leo, who is a sociology and science studies PhD candidate at the University of California, San Diego. Thank you for waking up for us this early. His research interests span science and technology studies, political sociology, economic sociology, and mixed methods. His current project focuses on the politics of algorithms and examines the design and implementation of two Chinese social credit systems. So Chang Jin will discuss algorithmic state vision as a means of seeing society, but also being seen by citizens. So looking forward to listening more about that. Let me just pull your video up. You can unmute yourself and try to share as well the slides. Thank you.
Okay, let me see. Okay. Can you see the slide?
Yes, everything is
great.
Yeah.
Thank you for the kind introduction. I'm actually in China right now, so morning is actually late night, and my brain is half now. So please forgive me if my speech is not that clear. So hello everyone. My name is Chuncheng Leo, and I'm a PhD candidate. And today I'm going to discuss about the algorithmic state vision. So I'm going to elaborate this with three aspects using health code, 健康码, the Chinese COVID contact tracing and risk assessment app as an example. So first, I will discuss about seeing like a state through algorithms, the establishment of the digital surveillance during the COVID-19 in China. Second, I will discuss about seeing the state through algorithm, how Chinese public receive the digital surveillance and the state during this practice. And third, I will discuss about seeing the state and algorithm through other states, how sometimes those perceptions of the state, algorithm, and surveillance are embedded in the relationship between China and the West. So those findings are from my interviews last year with Chinese residents who had used code. And for each aspect today, they are all published in different journals. Happy to share more details. So health code. What is health code? Serves as the basically health passport COVID-19 in China. When initiate the health code, it requires people to upload their own health information, such as name, ID card number, phone number, health history, etc. And using of the app was made mandatory for people visiting the public spaces and in some period leaving their own residential communities. So in design, health code works in an inspect, pass, or stop procedure. So at the entrance of spaces like office building, a checkpoint is set up with inspectors. So people passing the entrance are required to show his or her health code status, and sometimes also need to scan the QR code that the entrance was associated with. So health code would then generate 3 colors. Green means healthy, while the rest 2 means risk at different levels. So how was health code enacted in society? While public discourse often praise or criticize health code as an automatic algorithmic system rely on the big data, it does not operate in the social vacuum. Health code relies on human labor and specific environment to enact, which has been covered by a lot of speakers earlier. So for places with very clear physical boundary, limited entrance, and a mature security system or inspectors for an office building, it is very easy to enact health code. For other spaces, people need to be mobilized to initiative and sustain for health code operation. So a community government staff have to use the iron fences to block the open boundary of her old community to get a similar effect of a gated community and limited the entrance of the community to the health code regulation. The community governmental official also rely on personal connections with the residents and law and regulation to convince people to follow the rules. Establish surveillance camera network in China to ensure people to follow regulation as well as tracing the contact. But is this system stable? Yes and no. So China's very strong in organizing resources and infrastructure base results in a very quick assembly of health code in society. However, neither the state capacity nor coverage is universal. So health code status requires stable internet connection and GPS signal, and those conditions are not available. People entering into the office on the ground parking lot commonly facing the problem of or even unavailable from health code. So once the person he or she cannot even go back to the space just left. Meanwhile, there are several incidents where health code becomes systematical, such as the crash in Beijing health code. And the third, although all those problems could be argued as technical and could be resolved, usually no explanations are given regarding the incidents, creating a sense of uncertainty and deeper the mistrust toward the algorithmic system. So lastly, even if health code can work perfectly, it will still exclude certain citizens. So elderly people are the most obvious examples. Poor people who cannot afford a smartphone or data plan are also excluded by this system. Ironically, they might actually rely more on the public spaces and services, such as public transportation, when young and rich people could drive their own cars around. Their experiences highlight the hidden assumption of normalcy in health codes design and implementation during this rather abnormal time. Health code also local additional social actors are involved in the health code's implementation, contributes to the variation of them in practice. So people quickly found out that for the most of the time, health codes is elastic at best. Practically, it's really hard to everyone's health code carefully when this is reopened, considering the huge population in China. Other social logics also overturn the disease controls. Business intentionally ignoring the health code checking for small customers. Relational factor also matters as inspectors check people they know strictly. On the other extreme of this deviant practice is the actual scrutiny beside health code status. So in design, a health code, green health code represents a healthy status of a and could, free him or her from the further. But in reality, as the disease control task, many local governments are extremely cautious for people from Hubei, Wuhan, or other places with local outbreaks. So, for example, a Guangzhou journalist from Hubei was declined to interview people multiple times in March, even though he showed them his green local health code. People also commonly use shot of the user interface to skip the real operation of health code for different reasons. They also upload fake information into the system to avoid potential troubles. So a person with chronic throat pain lied about when uploading her symptom information to the system because she worried that the system only treats this symptom decontextualized. Some people even actively try to find social corners that are not covered by health code. Restaurants that do not check everyone's health group setting to avoid being surveilled. So how would the public, I'm moving to the second aspect of this, which is, how do the public understand surveillance algorithm and their relation to the state? So most people do not really think like scholars in terms of have a very strong and articulate stand on specific things such as surveillance. So most people are interviewed, again, as what previous panelists already discussed, as a trade-off. A more cynical response to this surveillance and privacy in China was what I called privacy fatalism, which means a belief that privacy concerns are irrelevant in China because no one ever have and will never have privacy in this country or in the age of big data. So an avid supporter of health code told me that worries about privacy and surveillance are useless here. Why? Because in China, no one has privacy. Health code will not be the last straw that crushed the camel. In fact, it's actually finally the government is using their data to do something good. Because of this surveillance is so pervasive in China before the COVID, people do not even feel the existence of health code surveillance and therefore do not consider being surveilled. People have all kinds of doubts about whether the digital surveillance is actually effective. Many doubts about algorithms, data inputs in the algorithm drawn from their personal experience when commercial AI keeps recommending them with the same products over and over again. They have this sense of, like artificial intelligence and big data is not that as smart as they claim to be after all. Meanwhile, people as it claimed. More interestingly, I found out that people commonly mention that it's better to be surveilled by the state compared with being surveilled by the private companies. This is due to their perception of how the different parties are going to use their data when collected. While the state might collect more data, most of those data are never really used actively against individuals. While anyone who Googles something and then received recommendations from Facebook and Amazon would know how invasive private companies' surveillance could be. So those all indicates that people's understanding of surveillance is in a rather relational way, which is associated with their own personal experience, their social positionalities, as well as their anticipation of how the data are going to be used. In fact, as the implementation surveillance as the figure for the this leads to my last for this discussion, which is seeing the state through other states. During my interview, I found out that surveillance practice and Western society's own surveillance practice are missing of the surveillance practice. So those perceptions can be roughly classified into the 3 stages. The first stage is when the pandemic was still largely perceived as only a problem in China, and other Asian countries. So expanded surveillance in China raised criticism of media focused on and human rights arguments, which to China's public. Many people perceive those criticism as attack on not only on Chinese government but also on Chinese people. It's that the West did not acknowledge the efforts and sacrifice that China made facing this deadly pandemic. Instead, they forward focusing on the rather abstract ethics of and surveillance. So facing the criticism arguments of whataboutism quickly on the internet in two ways. The first claimed that Western countries surveil their own citizens all the time too. So the U.S. was commonly mentioned for its surveillance program and national security agency in an attempt to delegitimize the Western society as a whole. The second argued that Western media only targeted China while intentionally ignoring others with similar private surveillance practice. The second stage is when the Western countries start experiencing accelerating COVID-19 outbreaks. At this stage, most host countries of media outlets that criticize Chinese surveillance practice did not actually enact intensive surveillance. In fact, many countries prepare very poorly for the COVID-19, sometimes even denying its severity. As the numbers of deaths in the Western society keep climbing, China starts to reopen its. This rather sharp contrast significantly undermines the legitimacy of Western political system as well as their ideological stance. Although Western media did not stop publishing critical articles on Chinese surveillance practice, they were taken less seriously and become the source of mockery within China. Think about this kind of comic I showed here. So the third stage is when the Western countries started to adopt surveillance practice, such as contact tracing, and when more media start to be more sympathetic to such practice in their own countries. So for many people, this further proved that China was right about surveillance from the beginning. These changing standards and media outlets also demonstrated their own hypocrisies. Studies already show that of surveillance in China, perceived as biased and unfair, generated reverse psychological effects and pushed residents to more fully embrace the state. Such effect only gets stronger and stage, accompanied by China's domestic 19 situation. So this is it is very here that those discourses are not necessarily based on accurate information. So for example, New York Times did report South Korea surveillance in the first stage, unlike many people claim that was solely targeted at China. So even when the Western society start to use the surveillance digital contact tracing, the difference between the Chinese and Western ones, such as the voluntary enrollment with mandatory income, has been largely ignored in Chinese discourse. Of course, the Chinese propaganda and censorship contributes to this public hostile attitudes towards West, dedicated misinformation campaigns. However, it's very problematic to assume that public opinions here are downstream effect of the state propaganda, ignore the complex social actually produce those sentiments. As the civilians have noted, many of the controversy and the debates surrounding surveillance of false economy. The binary pair of West and China, democracy and authoritarian, and human rights and the rest of being alive around surveillance during the COVID-19 are all salient examples. Those binary frames are simplified and problematic, yet powerful and prevailing as frame for public discourse. We think those frames being critical of one side is commonly misunderstood as being compliant with another. this is a problem that could be observed among Chinese and Western public, media, and policymakers. People who try to find the middle ground unfortunately often caught into the crossfire. Dr. Li Wenliang, the whistleblower of the pandemic who died of COVID-19, once said, there should be more than one voice in a healthy society. In this rather polarized environment, we should also say, there should be more than two voices in a healthy society. So that's all my presentation. Thank you very much, and looking forward to the discussion.
Thank you, Chuncheng. That was great. I think it fits very well with the narrative of the panel. I think we went a bit over time, and there is a question for Kirsten in the discussion, but I think I'm going to start with my question first, and which is to everyone. So we've seen and we've heard a lot of you talk about governments across the world that have chosen to solve basically the same problem, which is the pandemic, with the same means, which is the technological solutionism that Eva was talking about at the beginning. But what I see from your presentations and comparing them is the different countries that you guys have talked about, Germany, Iran, Israel, and China. We are seeing the response of people and their cultures influencing the ways they respond to these technological solutions. And now that we are moving into this new era of health passes and COVID passes and immune passports and NHS app and whatever everyone is calling it right now, again, which is a different kind of discussion. Do we see this relationship between, like the statism relationship between governments and citizens changing? Are we seeing a different perspective of how people perceive their governments, the limitations that they put on their rights, on their freedoms changing? And that also links to discussions about trust, I guess. So I don't know who wants to start on this.
I will jump in. Of course, that's a very important but equally complex question. I rather have the impressions when reading research on this that the relationship is not so much changing because of the technology implemented, but the relation to such technology is based on this relation to the state. So if you generally, of course, have a trust, then I don't think it would be, or to put it differently, I think if you have a general trust in the government, then it would destroy that trust rather by not protecting people in the area of social norms in a pandemic than by implementing technology. So if people lay their trust in the government, then trusting means thinking they will do the right thing.
Nice, thank you. Eva, do you want to go as well?
Sorry, can you?
No. Can you try again?
Yeah, okay, now it looks like it's working. Yeah, I think, I mean, from more perspective, I think it's probably a little bit too early to tell. I think definitely where there is a shift in narrative that's quite unique actually at the moment compared to, I mean, I was contrasting initially at the start of my presentation with like previous phase of like terrorist attacks and a similar sort of like restriction on human rights. I think what's very unique now, and I'm wondering to what extent this is really also reshaping how people interact with the state, is, you know, there's the carrot and stick narrative, and where, you know, if you get vaccinated, you're going to have more rights. You're going to be able to go out. If you get, you know, an immunity passport, you'll be able to travel abroad. And the same way Chuncheng was talking about how, you know, China has always had this data, and suddenly for the first time, there's something maybe good that was coming out of it for people. I think there is also this thing that, you know, at the moment now the state has something to give, whereas in previous instances it was always just about restriction of rights. Now there's a carrot, so to speak. There is like, oh well, if you do this and this, that, if you accept this, you will be allowed to get back to the rights you had before, which I think, you know, obviously is problematic. It's something we need to keep an eye on and ensure that there are safeguards around this.
Thank you. Would Azadeh or Chuncheng want to chip in? I
would just like to probably raise the same point that I raised in the presentation, that as Kirsten said, it's very much dependent on how the relationship with the government is already and what kind of different factors are playing in this playground when we have a crisis in the country. And I think I've already told Chuncheng about this personally, but I think this is, for example, a refreshing approach to China, because I think both of us come from countries that are sort of bundled up as this is Iran, this is China, and there is little really thinking about the contestations within these societies, that the different actors and different state actors, even there is this contestation even within the government, how these technologies are executed. So I think this is, yeah, I would like to emphasize again on the politics of location and how people are sort of situated, how these technologies are situated in different societies.
Do you know how I go with Chuncheng as well, just to finish this question?
Yeah, I think, I would just do it, you know, to build on the location point. I think it's also, you know, as basically half of my last presentation talking about the kind of international relationship also play a very important role in how people understand and actually how the government enforce a lot of the new technology and surveillance in different countries. And I think it's, it's very obvious to me that there are emerging kind of COVID nationalism in different countries, you know, either in China, seeing that we are the, you know, countries that actually a quick rollout of vaccine compared with, you know, other countries. So I think this is something that the geopolitical kind of context or international relationships are also something that need to be considered when discuss about domestic surveillance practice and their perspective.
Oops. Okay, thank you so much. I'm going to read out Nikki's comment on the chat, which I think is a question for Kirsten, but maybe Azadeh as well. So Nikki says, I wonder if you had any thoughts about the fluidity of trust, consent over a period of time during a pandemic. I'm thinking in terms of Singapore, which was relatively successful in containing the virus with a rigorous test and trace system. But then later admitted that early promises of privacy was not upheld and that police will be able to access the data. Were there anything that happened in Germany that might have affected trust in the state and by extension withdrawal of consent, by maybe too late? And do you think incidents like this in other parts of the world might affect trust in countries like Germany, for example? All of these might be something also that Azadeh might have some thoughts on as well. So I'm just gonna pull you, Kirsten. Okay.
I I didn't cover that in my research, so I can more speak of a general impression as living in Germany. But here I rather had the impression that it was put so much emphasis on privacy at one point, and the discussions were so long-lasting and intense that we might also have lost some of the potential of data to control the virus. So it's always a sweet spot, and some people, in the end, it comes down to personal preferences. And I think European, or especially German citizens, put a lot of emphasis on privacy, but what we might have missed is that this disbalance, giving away personal data every day to big tech companies, and now this data could actually have an impact. And yes, it might be misused, but maybe it would be okay to risk that for the social benefit too. And I think what was lacking in Germany is this understanding of this. When people hear privacy violations, it's a red flag, and that's fine and that's important, but to see it in relation to other behavior. And I think in Germany, the trust, to answer that question, the trust regarding the technology did not decrease, my personal opinion. However, maybe some more strong or brave measures would have been fine too, to show that technology and risking data might also be a good thing for the public good.
So I would also maybe emphasize here again that trust is also a sort of a collection of many other things and an intersection of many other things at the same time. And I'm also based in Germany, and I find it interesting that even in Germany, that with a lot of data protection regulations, there were other issues that were affecting people's decision to download the app or not. And interestingly, although a lot of experts were saying that the app is actually is not that bad, it's not violating your privacy, culturally, German people cannot trust a lot of digital technology. So cultural issues were playing a part. Then recently there were some corruption stories coming from the government, from the health minister, which was also affecting a lot, at least a lot of, I haven't done a study on this, but I think a lot of people were thinking, if the system is corrupt, why would I do this? So you would see that it is not only in authoritarian context that people are thinking about how would I trust the system. It is also in democratic countries that trust is a continuum. So it can, and a lot of things can really affect how people trust these technologies and the government's ability to control these technologies in people's favor.
Chuncheng, do you want to go ahead with your comment, or are you okay? Yeah, okay. All right, so I'm going to wrap up now. Thank you so much. All of your talks were amazing, and I think you gave us a lot of food for thought. Thanks for joining us, and we're waiting for the keynotes in about 15 minutes, and see you soon. Thank you.